Yes, Representative Miller.
Couple quick questions. Does Taiwan include dental care?
Yes, I forgot to mention that.
Okay. Second question. You said that Taiwan instituted a national computerized medical information system. Does that include claims payment and patient medical record? Is that all wrapped up together, or is it just a claims payment system?
The electronic system Taiwan established is there is a national electronic claim payment system, as well as national payment patient record system, but these two are not put together because of privacy. You do not want the patient's medical condition to be so open, have claim processing people all have access to that. So the smart card, when you use it to see a physician or go to a clinic, you can actually give a code which part of the information that doctor can see. Let's say if you have a mental health problem, you don't want the primary care doctor to know that. You can actually give a code which that information is not given. Or if you go, most likely they give permission to primary care doctors to see everything, but for specialists, they really restrict which part of their medical history and so forth that specialists can see.
Okay, well, I think looks like we exhausted the questions, and we're only 15 minutes behind schedule, so it might be a good time to break. Thank you so much.
May I just make
Yes. One final
brief comment? I mentioned earlier that, and I'm speaking personally now. I mentioned earlier that I've been plugging away at this problem for the last 40 years professionally, so far with a notable lack of success or results. Einstein once defined insanity as doing the same thing over and over again and expecting a different result. And I think I could be accused of being a poster child for that definition. However, I think my answer to that characterization is that I fervently believe, as a physician and as someone who's been involved in almost every aspect of medical care during my career, that it's simply the right thing to do. That's the short answer. I also think that the environment has changed over the last 45 years. I graduated from medical school in 1965. At that time, medicine was still very much a mission-driven enterprise. The mission was diagnosing, treating, hopefully curing, comforting, and healing patients. During the last, particularly 30 years or so, unfortunately, healthcare has become more and more about money. And much of the expense that Dr. Hsiao describes, it really boils down to arguments about money. Who's covered, what's allowed, what's denied, how do we appeal it, how do we maximize our income, how do we craft our practice or our hospital services to maximize the revenue. And that's particularly true as medicine has become more specialized, more corporatized, and less personal. I think some of the changes Dr. Hsiao describes have occurred in Taiwan and elsewhere will facilitate what I'd like to see, which is a return of medical care to its Hippocratic roots, being dominated by mission. That is, you're able to do what you think is best for the patient without regard to its impact on the bottom line. And I think there are a lot of ways to do that. We've heard some of them suggested today. On behalf of Maine AllCare, I'd like to thank you for allowing us to testify, and it's been a great experience for us.
Thank you very much.